COVID-19 is not the only public health threat we should be worried about. Loneliness is one as well. Social media has allowed a great opportunity for individuals and communities to stay connected even whilst physically separated. The COVID-19 support group on Facebook, which is currently has over 90,000 members, has helped many patients to deal with the psychosocial effects of COVID-19. To talk to us more about this, we now joined via Zoom by Dudu Mgolombane. She is the co-founder of this Facebook page. Good afternoon to you, Gugu. Thank you so much for joining us here on the SABC News channel.
Thank you, Palisa, and good afternoon to you too and to the viewers as well.
All right, so how did the idea behind the page come about?
Well, the idea came about to the founder, Ms. Nontozamo. She's a coordinator of HIV and AIDS at work. She said that she thought with the COVID-19, there's a lot of information that is there, but the psychosocial support is lacking. So there was a gap of the psychosocial support. Then she started the group on the 16th of June. And then as the numbers grew, she was able to ask me to come on board to assist her in managing the group.
All right, so how does it work? Just take us through how the group functions itself. I said on my introduction that you have over 90,000 members or followers as it is now. So you say the main idea behind the group was to provide that psychosocial assistance that may be needed or support. What exactly does the group do?
Oh, thank you, Palisa. Okay, Palisa, for now, to date, we've got 99,200 people. Members come from different races, different genders, ethnic groups, because COVID-19 of us worldwide. So mostly people get into the group, guys, I've just tested positive. What do I do? Where do I start? And then that's where you'll find it's a peer-to-peer advice that is more offered there. There are people that have walked the journey of COVID-19. I am one of them, a COVID survivor. So you are able to give an insight to a person who is new, who is nervous, who is afraid, whose main thought is death. When you say COVID to some people, it interprets death. So you'll be able to tell them that you'll be able to get through this. What do you have at home? What have you been given by a doctor? Are you by yourself? Then we're able to assist in situations like that, because one will tell you that we are living in one room and there's 8 of us and only 2 have tested positive. That's where we would advise to contact your department of health closest to you to go quarantine in those quarantine facilities that have been offered by government. Or if a person is living in a large homestead, then they'll be able to pick a room to themselves. And also we try to advise caregivers, because in this situation you need a caregiver, because at times you don't have the energy to even get out of bed, and obviously you have to isolate as much as possible to be by yourself. So we want to empower caregivers on how to interact with the positive person in the room.
So, but perhaps are there any plans to sort of collaborate or bring on board some health professionals, as you say? Because my understanding is that as it is now, this Facebook page is just on a peer-to-peer basic or peer-to-peer level. Are you perhaps looking into bringing some health professionals, maybe psychologists as well, to bring that professional level into the discussion?
We do have professionals, doctors. We've got 2 doctors that have volunteered their services to answer medically related questions on the group, on how to use some medications, especially when people are starting to face side effects from the medications that they might have been given by their doctor or a hospital. So we do have for their services, and we do also have 2 psychologists, and also we try to advise people to make use of SADC, as they offer the 24-hour counseling services to our members.
And what's the common theme? I'm browsing through your Facebook page now. What's the common theme from the discussions that you see take place here that usually pops out?
You'll find that most people are suffering from pain, and we try all of our members, we try to advise each other to use your home remedies to get through some stuff, not to always depend on tablets. You know, you will find that the onion to be quite helpful and assistive in some of our pains that we've been facing. So we try to assist people to look into their cupboard. What is it that they can use? Those who can't sleep, try a glass of warm milk at night. So that is what we mostly try to advise each other on.
All right, so you're a COVID-19 survivor yourself. Tell us a bit about your journey with COVID-19, how it started, and you being negative now?
Yes, I tested positive on the 14th of July after I just experienced a sore throat, and it was scratchy, and I did not take anything to it because my husband had tested negative. I was one of those people that had thought, if my husband who stays with me tests negative, then it means I'm also negative. So I started having this throat, and then Happy said, you know what, let's go to a doctor, just get it checked out to see if it's anything else. I get to the doctor could diagnose. I went to the lab. Following day, I got my results. I tested positive, and I had to isolate. Fortunately, it was just me and him in the house. Following day, I will tell you, I couldn't even get out of bed. I was struggling to breathe. Fortunately, there was a nebulizer, so he was able to oxygenate me. But that way, I could not even walk as far as the bathroom from the bedroom. It was terrible. I had lost appetite. Terrible 3 days. At some point, I had about 2 collapses in the room with just him. And at that time, it was when most hospitals in the Eastern Cape, especially I was in Amtata. In Amtata, we were told that the hospitals are fully.
So you had to recover.
Gradually with my medication. I've recovered.
Yeah.
I have recovered. I've tested negative.
On your own at home, because you couldn't get to a hospital?
On my own, at home, with milk and everything else, and the advices of the group.
But then how did you overcome the issue of the stigma that's usually associated with COVID-19? And I believe it's part of the discussions that are taking place on the Facebook page.
We are trying to keep people informed about the virus, because a lot of our people will come into our wall. Thank you guys, I've survived with all of your help, but now I'm being stigmatized at work. For instance, there was a lady that had said that at her workplace, she was told that she can't come to work because she's the one that had brought the COVID to the workplace. So we try to as much as possible to make people aware and ensure that our members are able to take the information that is from the group and take it to their families and into their areas of residence. That way, the more people know about this disease, the less stigma will be attached to it.
Well, I think you're doing quite an incredible job. Going through your page now, and I see a whole lot of people sharing their testimony, their recovery journeys as well. So, yeah, keep it up. Thank you so much for coming through, and all the best going forward.
Bali, we have a Women's Day celebration on Monday the 10th. It will be streamed live on our program. It will also go to points like stigmatization, HIV and AIDS, gender-based violence, and of course, our main content, COVID-19.
All right. Well, we'll certainly join you online. Thank you so much for coming through. Dudu Mgolombane is the co-founder of this support page. That's the COVID-19 support group that you find on their Facebook page with over 99,200 members who have joined. A lot of people sharing their stories there and their recovery journeys and advices, I believe, on a peer-to-peer level. A quick break. There is still so much more to come on SA Today. Do stay with the team.